Your Excellency, Minister and Vice Minister of Health of the Republic of Indonesia, Minister of Health of Lao PDR, Secretary General of ASEAN, Executive Director of IAPAC, Regional Director of UNAIDS Regional Support Team Asia and Pacific, representative from ASEAN cities, development partners, and all civil society organizations. Good afternoon from Jakarta, Indonesia, to all distinguished guests, speakers, and participants gathering here today. Welcome to the satellite session entitled Strengthening Integration and Inclusion of HIV/AIDS Program as Priority Agenda in the ASEAN Cities Toward Ending AIDS by 2030. My name is Andi Muhammad Yusuf Ridwan. I am the National Partnership TA Focal Point of EPIC Indonesia, and I'm pleased to be your host today for the session. We are very fortunate to be gathered here today virtually alongside representatives from ASEAN cities, health officials, communities, and development partners to participate in an important discussion on the HIV response, dealing with our commitment, especially ASEAN cities getting to 3 zeros. Integration and inclusion become a strategic approach to be ensured in all levels of HIV program. So today, we would like to hear the best practice sharings from the countries participating ASEAN cities getting to 3 zeros. Ladies and gentlemen, to officially open today's satellite session, I would like to invite Dr. Maxi Rondonu, Director General of Disease Prevention and Control, Ministry of Health Indonesia, to provide his opening remarks. Dr. Maxi, the floor is yours.
Your Excellency Dr. Bonfeng Pnomalasit, Ministry of Health of Lao PDR, Your Excellency Dr. Kao Kim Horn, Secretary General of ASEAN, Dr. Josh M. Suniga, Executive Director of IPEC, Master Eman Murphy, Regional Director of UNAIDS Regional Support Team Asia and the Pacific, Mayor of the participating cities of the ASEAN Cities Getting to Zero Initiative, City Technical Official, ASEAN Cities Getting to Zero National HIV Contact Point, and ASEAN Cities Getting to Zero National Community Representative, representative of international development partner and regional community stakeholders, ladies and gentlemen. First of all, allow me to welcome you all in this satellite session in Amsterdam. Here we will join forces to advance our commitment to ending AIDS by 2030 in ASEAN cities. Today we stand united with a shared vision and determination to strengthen the integration and inclusion of HIV and AIDS program as a priority agenda. This gathering holds immense significance as it provides us with a unique platform to share knowledge, experience, and best practice that promote evidence-based policy and program on HIV and AIDS across the ASEAN region. By coming together, we can establish a robust network of support that promotes collaboration and learning among participating cities. Thanks to the tireless effort and dedication of the individual and organization representative here today, we have made remarkable progress on the path to eradicating AIDS. We must acknowledge the significant progress made since the FTC conference held in Lisbon, Portugal in 2021, and Sheffield, Spain in 2022, these satellite sessions have proved to be indispensable in achieving our collective goals. As we convene here, we are guided by the NOSO 2 call for action on the ASEAN getting to zero city-based network on ending AIDS. This call for action was adopted in the October 2019 meeting of the ASEAN Cities Leadership Forum on getting to zeros. It also urged us to exchange information, experiences, and best practice while promoting evidence-based HIV and AIDS policy and program in participating cities. It demonstrated our determination to support sharing and learning activities between ASEAN cities in their struggle against HIV and AIDS. Excellencies, ladies and gentlemen, the satellite session involved the theme strengthening integration and inclusion of HIV and AIDS programs as priority agenda in Asian cities towards ending AIDS by 2030. This theme commenced following the fast-track cities themes integrity and inclusion. Inclusive policy with respect to the communities will bring a wide opportunity will allow the evidence based on public health to ensure the key population can be reached to receive the best health services related to HIV. Inclusion and integrity use an innovative approach to reach, treat, and retain the services to the people who are mostly in need. And here, which are today, discuss on how to strengthen integration and inclusive of HIV and AIDS programs. Today's session aims to produce specific output that will drive our collective efforts forward as follows. First, advocacy through the dissemination of lessons learned. The insight and experiences shared today will be meticulously documented in meeting reports. This document will be valuable resources capturing good practice and specific innovation that can be replicated in the other participating cities. This lesson will guide us toward the ASEAN commitment to ending AIDS by 2030. Second, demonstrated increased visibility of the Asian Health Cooperation on HIV and AIDS. Our presence here today amplifies the visibility of our collaborative efforts to combat HIV and AIDS within the Asian region. This visibility is crucial to garnering support from additional stakeholders and fostering an environment of shared responsibility. The participation of animated panelists representing a variety of sector and point of view greatly enhance the value of our discussion. Your knowledge and insight will assist us in developing efficient strategy in effective solution. In our efforts to end AIDS by 2030, we acknowledge that this problem extends beyond medical statistics. It is a complex interaction between social, economic, and human factors to be successful. We must ensure that our strategy is inclusive, compassionate, and grounded in evidence. Excellencies, ladies and gentlemen, each of you plays a crucial role in the realization of our collective goal, an ASEAN region where AIDS is a thing of the past, where health equity prevails, and where every individual's well-being is protected. Let's grasp this chance to strengthen the foundation of our HIV and AIDS program in ASEAN cities. Let's to cultivate collaboration, share knowledge, and empower our one another to have a lasting impact on our respective communities. In conclusion, I would like to extend my deepest appreciation to all the participants, panelists, and partners for being present today. Even though our time is limited, let's make the most of these precious minutes by engaging in meaningful dialogue and charting a course for a brighter and healthier future. Together, let us pave the way toward ending AIDS by 2030. Thank you.
Thank you very much, Dr. Maxi Rain, for your remarks and for highlighting the commitment of Indonesia in facilitating the ASEAN cities getting to 3.0, especially in a fast-track cities conference, and also emphasizing the importance of integration and inclusion as our key to end AIDS by 2030. Now, I invite Ms. Rodorati Babaran from ASEAN Sociocultural Community Department on behalf of ASEAN Secretary General to provide her remarks. Ms. Rodora, you have the stage.
His Excellency Budi G. Sadikin, Minister of Health of the Republic of Indonesia, Mr. Eamon Murphy, Director of the UNAIDS Regional Support Team for Asia and the Pacific, Dr. Jose M. Zuniga, President of the International Association of Providers of AIDS Care, distinguished mayors and representatives from participating cities of the ASEAN Cities Getting to Zeros project, HIV and AIDS contact points from ASEAN member states and Timor-Leste, ladies and gentlemen. It is my pleasure to deliver remarks on behalf of the Secretary General of ASEAN, His Excellency Dr. Kao Kim Horn, at the satellite session of the ASEAN Cities Getting to Zeros, as we showcase selected experiences, lessons, and practices from ASEAN cities in their efforts to end AIDS by 2030. We reiterate our profound commendation to the government of the Republic of Indonesia for championing multiple strategic priorities of the ASEAN health sector, including ending AIDS in ASEAN by 2030 through the ASEAN Cities Getting to Zeros project that was launched in 2012. This project, which has become the platform for regional networking and knowledge and experience sharing, has facilitated technical exchanges and cooperation on HIV and AIDS prevention and control with various stakeholders engaged with Fast Track Cities initiatives. It can be recalled that at the Fast Track Cities Conference in 2021 in Lisbon, Indonesia organized a satellite meeting which aimed to strengthen the gains of the Fast Track Cities initiatives from the impacts of the unprecedented global crisis of the COVID-19 pandemic. During these times, there were significant health resources that were redirected to COVID-19 response and other public health and social measures, such as lockdowns, that compromised the scheduled implementation of other non-public health emergency activities, including HIV programs. At a similar conference the following year that was conducted in Seville, Indonesia convened another satellite meeting which facilitated exchanges on how cities could get back on track from the negative impact of the COVID-19 pandemic and sustain responses to end AIDS by 2030. Let me commend UNAIDS and IAPAC for their continued collaboration and support, which enabled the ASEAN health sector through the leadership of the Ministry of Health Indonesia to carry out this important satellite session. Excellencies, distinguished delegates, For us to achieve the vision of ending AIDS by 2030, we must work hand in hand with all sectors and move as one towards accelerating appropriate responses to ensure equitable access to HIV services and solutions, to break down barriers through better policy and legal strategies and community engagement, and to improve resource mobilization to ensure efficient and sustainable responses that are integrated into health systems. The aforementioned are the key commitment areas of the ASEAN Leaders Declaration on ending inequalities and getting back on track to end AIDS by 2030 that was adopted at the 41st and 42nd ASEAN Leaders Summit in November 2022. Lao PDR, as the current chair of the ASEAN Health Sector, has taken on the leadership of the implementation of these commitments in the declaration. In line with this, we would like to highlight the critical role of cities, municipalities, and communities, led by our mayors and local chief executives, working hand in hand with various stakeholders, including key affected populations, in realizing the strategic targets towards ending AIDS by 2030. We count on your continued cooperation and engagement with the ASEAN Health Sector as it operationalizes these commitments through the implementation of regional programs and projects of the updated ASEAN HIV and AIDS Work Plan 2021 to 2025. Excellencies, distinguished delegates, I congratulate the representatives of the participating ASEAN cities for sharing their experiences, lessons, and good practices in the engagement of the private sector, persons with disabilities and youth, and other key affected populations in harnessing the value of partnerships and innovation in HIV and AIDS management. I also look forward to the substantive exchanges of views and insights in better achieving our vision of ending AIDS by 2030. I wish you a productive meeting and success in all your endeavors. Thank you.
Thank you very much to Ms. Rodora for those important remarks, convincing us the ASEAN commitment, especially in enhancing the partnership, work hand in hand to end AIDS by 2030. I now invite Mr. Jose M. Juniga, Executive Director of IAPAC, to provide his remarks. Mr. Jose, the microphone is yours.
Thank you very much. My formal greetings to Dr. Maxi Ren Rondon, Director General of Disease Prevention and Control at the Ministry of Health of Indonesia, Mr. Kao Kim Puran, Secretary General of ASEAN. My warmest regards to my colleague, Mr. Imon Murphy, Regional Director for Asia Pacific at UNAIDS, with which IAPAC has partnered over the last 9 years in advancing the objectives of the Fast Track Cities Initiative. I'm grateful that you have selected the Fast Track Cities 2023 conference, which is taking place this week in Amsterdam, to host the third satellite symposium of the ASEAN group focused on strengthening innovation, integration, and inclusion in ASEAN cities towards getting to zero. We've made such steady progress over the last 9 years of this initiative. Progress has been reported here in Amsterdam by quite a number of fast-track cities, including the Asia-Pacific region. We were excited to hear from Deputy Governor of Bangkok, Dr. Davida Kamalvesh, the exciting news of how integration and as important inclusiveness activities within her Bangkok Metropolitan Administration have yielded quite significant progress, even in the face of COVID-19, and as the city recovers. This steady progress has been noted across the Fast Track Cities network, and we have proof of concept that we can actually achieve the Fast Track Cities objectives if beyond the closing of gaps in relation to antiretroviral therapy and PrEP, by addressing the inequities and inequalities, and as important, the invisibility of communities that are most affected by HIV. Amsterdam's motto is to be brave, committed, and compassionate, and that we believe is key to maintaining the momentum on an initiative that is now in its 9th year, entering its decade anniversary next year. I commend all cities in the ASEAN region for their commitment to the Fast Track Cities objectives, targets, and goals, and as important, recommend strongly that you continue on your path towards ensuring both integration and inclusiveness in your HIV responses, but as important, that you continue to innovate in a way that you can share with other cities across the Fast Track Cities network, as we've been doing for the last 3 days here in Amsterdam, and persist. I'll close only by saying we have that proof of concept. So those of you who are not aware, the mayor of Amsterdam announced here at the opening on Monday that in the city of Amsterdam, there were 9 new HIV infections in 2022. It can be done. The challenges are significant. The inequities are stark. But with persistence, with innovation, with integration, inclusiveness, and within realizing the human right to health, dignity, and prosperity for all people, we can achieve the goal. Thank you very much, and I wish you a successful satellite session.
For your remarks, and of course for the collaborative and continuous support to the work by ASEAN cities, especially ASEAN effort in HIV/AIDS response. Ladies and gentlemen, at the moment, I would like to invite Mr. Eamon Murphy, Regional Director for UNAIDS Asia Pacific, to give his remarks. Mr. Eamon, the audience is yours.
Thank you for inviting me to speak today. The ASEAN Getting to Zero Cities project prompts us to ask 2 questions that are key to ending AIDS as a public health threat by the year 2030. Firstly, who is most at risk? And secondly, where do most transmissions occur? The answers are clear. We must strengthen our efforts to serve key populations who account for more than 95% of new infections in Southeast Asia. That includes men who have sex with men, people who inject drugs or use drugs, sex workers, and transgender people. HIV rates amongst key populations in ASEAN cities range from 6% to over 44%. This means that much of our efforts need to be concentrated in our cities, in the urban settings, from Bangkok to Manila to Jakarta to Tampo Ho Chi Minh. Migration, high population density, societal and economic inequalities, and the distinct culture and pace of urban life. All of these combined increase levels of risk, particularly for people who are new to the urban settings. But if our cities are hotspots for HIV transmission, they can also be hotspots for innovation, for community leadership, and political will and action. This focus on population and location has empowered the ASEAN countries to develop city-specific HIV strategic plans. These plans both strengthen HIV services and create a more supportive environment for the delivery of these services. For example, in Indonesia, the digital Test JKT, Test Jakarta campaign, and the AI-generated chatbot, Tanya Marlo, are reaching young men who have sex with men and transgender people with tailored messaging. They're also converting this online engagement into access to testing, PrEP, uptake, and linkage to care. So taking and using the virtual space to connect those who need it with services they may not access otherwise. In Bangkok, there has been an expansion of migrant-friendly health services and a targeted response to ensure that a new generation of children of these migrants is born HIV-free. The Philippines has established sundown clinics, increasing access after work hours for many who usually would find it challenging to seek care during the usual work hours that the clinics were open in the past. The ASEAN Getting to Zero Cities project is now 12 years old. This was a landmark initiative of the 2011 ASEAN Declaration of Commitment on HIV. Last November, member states of ASEAN reaffirmed their pledge to accelerate progress towards ending AIDS as a public health threat by the year 2030. The new and current declaration rightly notes that HIV infections are rising in populations of young men who have sex with men and transgendered people, particularly in many of our ASEAN cities. Across the region, there is increased clarity about who to work with in the response to HIV and how. This, therefore, is our window of opportunity to accelerate progress. Use the urban settings these young people go to help them access service, reduce new infections, and prevent further expansion. For example, we know that PrEP has the potential to markedly lower new infections, yet too many cities have not yet transitioned from pilot projects to full rollout. Very much needed. We are nowhere near the level of coverage for PrEP in cities or in ASEAN that we need. This is not only a service delivery challenge, it's also about addressing the societal factors that increase people's vulnerability and block or hinder their access to services. This is the work we must deepen and expand across cities in Southeast Asia. Learn from each other. Use the examples of the Philippines, of Indonesia, of Thailand, and other places, Vietnam. There's so much to learn with cooperation between the member states. Let's continue to generate local evidence and implement these homegrown solutions to reach the people who most need services where they are and when they need it. You have the commitment of UNAIDS to support the generation of local evidence and the development of high-impact interventions. We also reiterate our support to the joint work with the International Association of Providers of AIDS Care, or IAPAC, which includes guidance, tools, and technical resources. The AIDS response can play a transformative role as a pathfinder for broader health and development. Through the enhancement of partnerships with elected leaders, public health officials, communities, we can build stronger systems and shift norms. It's really critical to understand that these fast-track cities innovations hold the potential to extend beyond the HIV response, making cities healthier, happier places for everyone. Let's make that potential our joint reality. Thank you very much.
Thank you, Mr. Imon, for your remarks. And of course, highlighting the breakthroughs in HIV/AIDS response. And of course, emphasize us this agenda is also in line with the global AIDS strategy. Ladies and gentlemen, I would like to invite now all participants to hear the keynote speech of the Minister of Health of Indonesia, which are going to be delivered by Vice Minister of Health of Republic Indonesia, His Excellency, Mr. Dante Saxono Harbuono. Mr. Dante, the floor is yours.
Excellency Minister, Secretary General of ASEAN, Mayors, distinguished guests, ladies and gentlemen. Welcome to the satellite session of Asian City Getting to Zero's Strengthening Integration and Inclusion of HIV and AIDS. Today, we gather here to address a pressing concern that demands our united action, the HIV epidemic in the Asian region. In 2021, there were estimated 1.9 million people living HIV in Asian countries, and approximately 78,000 new infections. We cannot stand idly by while this devastating virus continues to claim lives and inflict suffering on our communities, particularly among key population. We must confront this challenge head-on, armed with solidarity and compassion. In 2016, leaders from Asian member states took a decisive step in fight against HIV by adopting the Asian Declaration of Commitments, getting to zero new HIV infections, zero discriminations, and zero AIDS-related death. Furthermore, in 2019, the Nusa Dua Call to Action on ASEAN Getting to Zero city-based network on ending AIDS, agreed upon by mayors from ASEAN member states, reinforcement our determination to collaborate and share knowledge in promoting evidence-based policy and program on HIV and AIDS among participant cities. Today, I wish to draw your attention to three vital aspects that demand our immediate attention. First, integrating HIV service at the primary healthcare levels, engaging the private sector in combating HIV, and unlocking the power of data. Firstly, accessible and quality healthcare service at the primary level are foundational. In integrating HIV service into primary healthcare, we ensure early diagnosis, timely intervention, and continuity of care to those living with HIV. We must focus on strengthening primary healthcare facilities across the country and expanding service for HIV, TB, and HCV through private-public partnerships. Equipping healthcare providers with the necessary knowledge and tools will ensure even the most remote community receive quality HIV service. Collaborating with community leaders, local government, NGOs, and international organizations is crucial to effectively combat HIV. We must eradicate stigma through awareness program, fostering a cultural empathy and support for those affected by HIV. Secondly, I wish to emphasize the importance of collaboration, working together with the private sector in HIV response. It is important to build linkage between public and private primary healthcare in providing service to the communities, adhering to the highest standard of care and fostering the individual inclusive health ecosystems. Effective collaboration will leverage the diverse expertise and resource availability both from the public and private sector. Lastly, data is our foundation of evidence-based decision-making. We must invest in developing robust digital systems, allowing for stronger surveillance system and monitoring progress of our intervention continually. In this data-driven approach, allow us to identify gaps, assess the impacts of our initiative, and adapt our strategies accordingly. As we move forward, let us remember that our success lies in our unity, compassion, and dedication to build a healthier Asian community. Through the Fast Track Cities Network and core partner, we seek to fast-track our HIV response, ending AIDS epidemic by 2030. Together, we will turn the tide against HIV and create the brighter future in the Asian region for generations to come. Thank you.
Thank you to the Dr. Dante for delivering the keynote speech of the Health Minister and elaborating the beneficial efforts of HIV/AIDS to integrative and inclusive approach. Especially, he also enlightening our minds with evidence-based as the great foundation for our great effort. Last but not least, we would like to invite Mrs. Kantano Manitip, Permanent Secretary of the Cabinet, representative from Lao PDR, as Chair of ASEAN Health Ministers Meeting, to deliver an update on ASEAN commitment in following adoption of ASEAN Leaders Declaration on ending inequalities and getting on track to end AIDS by 2030, which adopted by the 40th and 41st ASEAN Summit in Phnom Penh, Cambodia in November 2022. Mrs. Kantanong, you have the spotlight.
His Excellency Budi G. Sadikin, Minister of Health of Indonesia. Mr. Imon Murphy, Director of the UNAIDS Regional Support Team for Asia and the Pacific. Distinguished partners and delegates, a pleasant day to all of you. On behalf of the Ministry of Health of Lao PDR, as the current chair of the ASEAN Health Ministers and Senior Official on Health Development, it is my honor to address you today at these important gatherings. I will share updates on the sustained efforts of ending AIDS in ASEAN, which have been recently reaffirmed and refined through the ASEAN Leaders' Declaration on Ending Inequalities and Getting on Track to End AIDS by 2030, which was adopted at the ASEAN Summit in November 2022. This further reaffirms the highest level of political commitment in the ASEAN regions towards enhancing collective efforts in addressing HIV and AIDS. Before proceeding, let me take the moment to acknowledge the significant contribution of the government of the Republic of Indonesia in our efforts to end AIDS in ASEAN. This is through their leadership in the inception of and valuable progress of the ASEAN Cities Getting to Zero, which was launched in 2012. This was an important initiative of the updated ASEAN HIV and AIDS Work Plan 2021 to 2025, which is a consolidation of regional initiatives to fulfill ASEAN's commitment in addressing HIV and AIDS. Excellencies, distinguished participants, the ASEAN and its member states have a long-standing commitment, strong political view, and leadership in responding to HIV and AIDS. These have been illustrated through the declaration of political commitments and their subsequent implementation through adopted work plans based on an agreed governance and implementation mechanism through a functional AIDS task force for working group and mobilization of technical contact points and advocated since 2001. When the ASEAN health sector embarked on the implementation of the ASEAN Strategic Framework on Health Development 2011 to 2015 and the ASEAN Post-2015 Health Development Agenda 2016 to 2025, the gains from the implementation of the work programs on HIV and AIDS since 2001 were further guided by the implementation on the 2011 ASEAN Declaration of Commitment, Getting to Zero New HIV Infection, Zero Discrimination, Zero AIDS-related deaths, as led by the Indonesia, and by the 2016 ASEAN Declaration Commitment on HIV and AIDS, fast-tracking and sustaining HIV and AIDS response to end the HIV epidemic by 2030, which Lao PDR was given the opportunity to lead. While ASEAN and its member states have demonstrated progress in our journey towards ending AIDS in our region, we also acknowledge that the achievement of our targets since 2016 is uneven and delayed due to widening inequalities with fragile health system, that have been further compromised by the impact of the pandemic. And due to subsequent socio-economic development, barriers or consequences that further enhance stigma and discrimination in key populations and communities. Excellencies, distinguished participants, informed by ASEAN's knowledge and experience through decades and addressing HIV and AIDS, and by global framework such as Global AIDS Strategy 2021 to 2026 and the political commitment on HIV and AIDS adopted at the 2021 UN high-level meeting on AIDS, the ASEAN health sector has reviewed and revisited its commitment, strategies, and approach to end AIDS. At the UN high-level meeting on AIDS held in June 2021, the former chair of the ASEAN Health Minister meeting, His Excellency Health Minister Budi Sadikin, delivered a collective statement which reaffirmed ASEAN commitment to ending AIDS. Continuously committed to lead HIV and AIDS related initiative, and as the incumbent chair of the ASEAN Health Minister and senior health official, Lao PDR has volunteered to transform the statement into renewed commitment through the ASEAN Leaders' Declaration on Ending Inequality and Getting on Track to End AIDS by 2030 that was adopted by our leaders in November 2022. This declaration outlines 4 key commitment areas. First, by getting back on track, which will be realized by implementing the commitment made at the UN high-level meeting on AIDS in 2021, by prioritizing HIV prevention, and by continuing to emphasize HIV testing and treatment, including elimination of mother-to-child transmission. Second, by supporting communities, which will be realized by ensuring that people living with HIV and AIDS, as well as key populations, have access to prevention, testing, and treatment. That community-led organizations are empowered. That community-led service delivery and social contracting will be further investigated. And that community-led monitoring will be further supported. Third, by ending inequalities. We aim to realize this by removing political barriers, by reforming discriminatory and punitive laws, as well as by eliminating stigma and discrimination. And fourth, by financing and sustaining efforts. This will be achieved by further strengthening political leadership, by raising sufficient financial resources, including domestic financing, by promoting greater regional dialogue and cooperation, and by committing to periodic reviews. Excellency, distinguished participants, the ASEAN health sector, with the continued support and cooperation and UNAIDS, WHO, and other regional HIV and AIDS partnerships, is now operationalizing this 2022 declaration. A consultation meeting of the ASEAN contact points on HIV and AIDS was conducted in June 2023, which review the operational statements of this declaration and revisited the progress of the current HIV and AIDS work plan 2021 to 2025. They will agree revisions on the work plan to be aligned with global and regional trends and directions. A follow-up consultation meeting was subsequently conducted in the third week of September 2023. It further reviewed and finalized the 23 regional project activities on HIV and AIDS for further implementation. We will be happy to share further updates on the implementation of the delegation in your further meetings. Excellency, distinguished participants, I conclude this intervention by conveying my heartfelt thanks to each and every one of you for your tireless dedication and unwavering support in our collective journey to end AIDS in ASEAN and globally. I wish you all a successful and productive meeting. I look forward to receive the outcomes and recommendations. Thank you very much.
Thank you, Mrs. Kantanom, for the ASEAN updates commitment. Ladies and gentlemen, we will now head into the panel presentation and discussion that I'm sure we have all been waiting for. In this panel, we have speakers from 3 of participating cities of the ASEAN cities getting to 3.0 initiative. And I will mention the country, Indonesia, Thailand, and Philippines. And this panel will be moderated by Ms. Alice Whedon, the Community Support Advisor of UNAIDS Indonesia. Without further ado, I pass the floor to Ms. Alice and wish all speakers and participants have a great discussion ahead.
From UNAIDS Indonesia, I'm pleased to serve as moderator in this virtual panel session on ASEAN Cities Getting to Zero. That is a satellite meeting of the Fast Track City Conference 2023. In this panel session, we will have all female speakers, this is wonderful, that will showcase best practices from 3 cities in ASEAN, from Jakarta, Phuket, and Manila. I will introduce all the speakers. Our first speakers will be Ms. Dwi Octavia Tatri Lestari Handayani, Head of Disease Prevention and Control, Jakarta Health Office. Dr. Dwi Octavia has her first bachelor degree from the Faculty of Medicine, University of Indonesia. She also has her Master of Epidemiology, Field Epidemiology Training Program from the Faculty of Public Health, University of Indonesia. Our second speaker is Ms. Kusuma Swangpun, Public Health Technical Officer, Senior Professional Level from Phuket Provincial Public Health Office. Ms. Swangpun has her bachelor degree in Nursing and Public Health Science from Yala Nursing College and Sukhothai Thammasat University. She also has her Master of Science from Mahidol University with a field in appropriate technology for resources and environmental development. And recently in 2019, Ms. Swangpun has received a Doctor of Philosophy from Khon Kaen University, majoring in Community Health Development. Our third speaker is Ms. Cherise C. Malbasia, focal person for tuberculosis and HIV Disease Prevention and Control Bureau from the Department of Health of the Philippines. Ms. Cherise has a Doctor of Medicine from the University of the Philippines and has a diploma in Public Management Majoring in Health System Development from the Development Academy of the Philippines. I welcome all the three speakers today. And in this panel presentation, it will run for 40 minutes, and each presenter will have at least around 12 to 13 minutes to present. So please note your time. At the end of the panel presentation, we will, of course, open question and answers for at least 30 minutes. So please stay tuned. You may already put your questions in chat in the meantime during the presentation, and we will have them presented at the end of the panel presentation. With that, I would like to call the first speaker for today, Ms. Dwi Octavia, who will talk about collaborative partnership for integrated HIV response, engaging the private sector in Jakarta. Ms. Dwi Octavia, the floor is yours.
Hey, Alice, good morning. Thank you very much for introducing me. I would like to thank also the organizing committee to invite Jakarta Health Office to share presentation about the collaborative partnership for integrated HIV response, engaging the private sectors. Well, this is maybe just an example from Jakarta, and I would also like to hear more examples from other cities also. Jakarta, the capital city of Indonesia, plays significant role in Indonesia, not just as nation capital, but also as a business city that gives opportunities for people to seek for jobs, doing business, pursue higher education, and etc. This invites high urbanization to Jakarta. Recent data shows around 11.2 million people lives in Jakarta. Nowadays, more people work in Jakarta but lives in surrounding Jakarta. There are around 28 million people if we count for all Greater Jakarta residents and others who live in surrounding Jakarta but work and do many activities in Jakarta. As you see that the map at the lower part of my slides, the red lines indicates the Jakarta area within the red line, but the outer areas is that Greater Jakarta, surrounding cities that every day people lives around outside of Jakarta but works in Jakarta. Besides potential economic growth, this condition brings also challenges like health problems such as HIV burden that need comprehensive approach to reach a goal to stop the epidemic. And as much we see that around 33,000 people living with HIV now are in ART in health facilities in Jakarta. And realizing that huge number of people living with HIV in Jakarta, comprehensive action is impossible to rely solely on the government. Jakarta government brings concept of pentahelix collaboration that call for active roles taken by stakeholders. This approach consists of government, academics, media, private sectors, and communities itself. Each of the 5 elements has its own roles and work in synergy to optimize program implementation. The private sector is an important component as they contribute mainly in providing education, case finding, and HIV service provision. It is crucial to engage the private sector in Jakarta. The working age population is proportionally largely demographic group in Jakarta. Many of the key population groups at risk for acquiring HIV are part of this age group. Partnering with the private sector allows the Jakarta Provincial Health Office to provide education and HIV screening to workers in this age group. The corporate social responsibility or CSR by private companies can also be utilized to support the implementation of HIV programs. Furthermore, private hospitals and clinics remain essential for supporting the government's public health programs to tackle the HIV burden. This is a framework used in Indonesia's HIV program, which we have abbreviated as STOP, consisting of S for Suluh or educate, and T in Indonesian language means temukan or find, O is obati or treat, and P stands for pertahankan in Indonesian language or retain. We will see in the following slides how the private sectors is engaged in each element of this framework. The Provincial Health Office, in collaboration with Department of Labor and private sectors, provided TB, HIV, and non-communicable disease education and screening at private companies, integrated with the HIV screening and other health-related issues screening program. It includes workers at local. We open the screening not just in health facility, but also in companies and also in like malls and other public area. And in 2022, around 30 companies and 17 malls in Jakarta participated in this strategy. After employees have completed their scheduled working periods, those who return from offshore sites like in mining company, for examples, are provided with self-administered HIV screening kits before returning home. Likewise, construction workers are also given self-testing kits for screening at construction sites. Workers who screen reactive will be accompanied by outreach workers to attend confirmatory testing at the nearest health facility or the health facility they choose, and subsequent treatment for those who test positive at the local health facility. These activities engage corporation with screening conducted at 14 sites, and as many as 5,000 workers received self-testing in 2022. For treat the people living with HIV, the private sectors is also engaged in providing HIV-related care through private clinics and hospitals. Testing services are available at around 70 private hospitals, 30 of which also provided care, support, and treatment services, along with 6 private clinics. Crucial to HIV treatment also is viral load monitoring, and which can also be supported by the private sectors in providing viral load testing through private laboratory networks that we set up. And for P or pertahankan or retain, part of ensuring good quality HIV service is in providing services which help retain patient. And during the COVID-19 pandemic, the Jakarta Provincial Health Office, with support from linkages and the EPIC Indonesia, provided home-based ARV delivery to patients' homes. A significant milestone we reached when Jakarta Provincial Health Office, with support from EPIC, established a partnership with Good Doctors Technology Indonesia. This is a private telehealth platform, and this allows the streaming line and integration of home-based ARV delivery with teleconsultation process, providing our patients with hassle-free, timely, and accessible healthcare. And for the viral load, we established 36 viral testing labs in Jakarta, which can provide viral load testing. However, to better cater for the needs of our patient, a differentiated approach must be considered. And to conclude my presentation, in the future, we see many opportunities in the partnership in Jakarta that we can build with private sectors. The flexibility and creativity offered through private institutions offers endless possibilities in how we can differentiate services for people living with HIV in Jakarta. Furthermore, with increasing practice on e-learning, we also see the opportunity for capacity building for our healthcare workers through educational platforms provided through private companies. And last but not least, in case finding, treatment monitoring, and other related diagnostic, we hope to more closely work with private sectors in closing any gap we may have in our programs. Thank you very much, and I'll give the mic returns to Alice. Thank you.
Yeah, thank you very much, Ms. Dwi Octavia, for the presentation. And I would like to call the next presenter, Ms. Swangpun, that will talk about enhancing multi-sectoral collaboration to reduce stigma and discrimination to end AIDS in Phuket. The floor is yours.
Good morning, ladies and gentlemen. It's my pleasure to meet you today, and I would like to present on topic enhancing multisectoral collaboration to reduce stigma and discrimination to end AIDS in Phuket. Presentation issue include HIV/AIDS situation in Phuket, highlight of successful initiative and practice, stigma and discrimination, lesson learned and challenge, and next step. Phuket has the important health service network consists of 5 public hospitals, 4 private hospitals, 17 health promoting hospitals, 12 primary care units, 4 drop-in centers, 1 prison, and 3 non-government organizations. HIV situation in Phuket estimate 4,655 people infected with HIV. Know your HIV infection state that 126%, receive ART 95%, and viral spread 92%. Phuket strategy to end AIDS consists of access to quality service, integrate effective prevention, improve the quality of care and treatment mechanism, for protecting AIDS and sexual diversity, reduce stigma and discrimination, coordinate and connect operation at all levels. Highlights of successful initiative and practice include sign of a memorandum of cooperation between Phuket Province and the Department of Disease Control and Healthcare Accredited Institute to end AIDS on November 2021. To set a committee and ending AIDS in Phuket Province. Focus on providing HIV service with the RRTTR package, which consists of read, recruit, test, treat, and retain. Increasing counseling skills for healthcare workers and networks. To join together in planning to end AIDS Phuket for the goal that include reduce new infection, reduce stigma and discrimination. The provincial multidisciplinary working group drive the mechanism for protecting AIDS and sexual diversity. Reduce stigma and discrimination in pilot area at Talang district. On July 2022 and 2023, focus on hospital, people living with HIV and community. Important activities in the hospital include multidisciplinary hospital conference policy hospital knowledge and attitude survey, continuous quality improvement, improved service system, and S&D e-learning. The situation of stigma and discrimination has improved after intervention among hospital staff. Important in people living with HIV include knowledge and attitude survey, HIV/AIDS knowledge by individual and by group. The situation of stigma and discrimination has improved after intervention among PL/HIV. Important activities in community at Sunthorn sub-district that pilot area include knowledge and attitude survey, HIV/AIDS knowledge. Assessment of public knowledge found that has improved after intervention in community. And assessment of attitude assessment found that still problem or most people undecided to get tests for HIV or AIDS because they are worried that people around them will know if they are infected with HIV. So important lesson and challenge in driving the work found that it should be established as provincial public policy, multi-sectoral stakeholder engagement, constant engagement for service provider, and community employment. The strength of this factor will create success toward ending AIDS in Phuket. And next step, to sustain and explain stigma and discrimination, reduction effort, public policy communication, implement activity in healthcare facility, focus pre-service training for service providers, adjust activity to suit to the target group, strengthen collaboration with stakeholders. Thank you very much for your attention.
Thank you, Ms. Swangpoon, for the presentation. Now I will call the next presenter, Ms. Mabasya, who will talk about making HIV services more accessible to the young key population. The floor is yours.
So thank you so much, Ms. Widen. So right now I'm going to present how we are currently moving towards improving the access of HIV services to the young key populations in the Philippines. Oh. Okay, so the Philippines, based on the 2022 data, is showing a rapid increase in the number of new HIV infections and AIDS-related deaths as compared to the decreasing trend globally and the Asia and the Pacific. Of the increase, based on our modeling last May 2023, nearly half of the projected increase will come from the 15 to 24 age group. Aside from that, based on our recent survey, these populations are disproportionately affected by HIV, and these populations also includes the 15 to 24 age groups. Thus, how does the Department of Health envision to address this growing epidemic? And from this model, we see that it's not only the health sector that needs to address this challenge, but there needs to be a multi-sectoral collaboration as well, since 80% of the HIV epidemic is caused by the social determinants of health. As a Department of Health, our main mandate is to ensure the quality and of the services being delivered by our public health facilities. And with that, we have recently released what we call the Omnibus Health Guidelines. In the Omnibus Health Guidelines, we have set the standards of care for each life stages. So unlike this clinical practice guidelines where it's basically focused on one disease, in this Omnibus Health Guidelines, we framed it into life stages, and this was done also to ensure integration of services so that HIV services is not only being given in silo, but also in integration with other services as well, and thus covering more population and more chance of the young population getting access to these services. So these guidelines, the intended users of this are the Filipinos themselves and also the primary care provider, where most of the integrated services are being delivered. In the Omnibus Health Guidelines, we have spelled out the services that should be delivered along the cascade of care in the HIV. So in this slide, the black ones are already being implemented, while the blue ones are in the pipeline or in the pilot phase. For the adolescents, where most of the young key population services can be found, at present we are able to provide HIV self-testing kits. So it is allowed based on our Omnibus Health Guidelines. Our adolescents are also encouraged to seek access to HIV and STI services following some signs and symptoms. And based on the guideline, they should have HIV RNA viral load testing after experiencing flu-like symptoms within 1 to 4 weeks after a risky sexual or injection is found. All adolescents also, when they have tested positive, will be assisted by their parents or caregivers or any competent authority to seek appropriate management to our facilities. It is also provided that they should be given the following vaccines during their life stage or annual. Thank you. These services are being delivered under the frame of the universal healthcare, and in the hope of fully implementing this universal healthcare, we would like to ensure that there will be no sector that would be left behind, and that these services will be equally accessed by everyone. So aside from the health sector strategies, we also have to ensure that our cities, our LGUs, are able to create an enabling environment for health. And as we know, our cities are centers of schools, workplaces, where our young key population are also found. And we have already implemented key health promotion campaigns focusing on the 7 priority behaviors, and also the primary care provider campaign, where we wanted to generate demand for this primary care services. So these are the 4 major campaigns, which includes HIV. One of the key strategies as well for health promotion is integrating this to celebrations where our key populations are mostly found. So during the Pride Month, last June 2022, we have provided self-testing services in that and other HIV services. And then in the World AIDS Day, we had a caravan in different cities where HIV prevention method testing, treatment, and free consultation are provided. These are examples of the IECs that are being used in the campaigns, and we have already developed key messages to encourage testing and treatment. This one specifies how they will be tested, how they can get testing, and what are the different methods and how they can access these testing services. In our way forward, so there are still a lot of legal and stigma that needs to be overcome to reach the young key population. Thus, in our, we are currently drafting with the PNAC, Philippine National AIDS Council, leading the 7th AIDS Medium-Term Plan, where one of their specific objectives would be to improve the basic knowledge on HIV transmission and prevention, and prevent new infections. And to do that, these are our key strategies. So development and implementation of policies and guidelines to improve access to combination prevention, development of prevention communication plan, implementation of differentiated HIV testing service guidelines, and development of evidence-based, age-appropriate, comprehensive, and life skill approach to HIV education, which includes a comprehensive sexual education in schools. With that, thank you so much.
Thank you very much for all presentations from Jakarta, Phuket, and also from the Philippines. I'm now pleased to open question and answer session. All the questions may be put into the chat, then I will read them out for all the presenters. This is a strategic opportunities, of course, for cross-learning for cities in ASEAN, and we encourage cities to ask questions or share experience on how to move forward ending AIDS by 2030. For example, in Jakarta, we have learned about the engagement of private sectors and home-based ARV delivery in partnership with the private sector, good doctor technology. And also in Phuket, it's very interesting to learn about a comprehensive intervention to reduce stigma and discrimination at the health setting. While in the Philippines, it is very engaging also to hear that there are efforts on making HIV services more accessible to the young key population, to providing enabling environment for health promotion, such as targeted campaign, addressing stigma and discrimination, and the provision of prevention services that are key, such as testing services and other prevention services for young key population. So we have learned all the best practices from the cities, and I would like to invite all the questions from the panelists. We have several questions, 1, 2, 3, all for Indonesia. I also would like to invite questions to the Philippines and also to Phuket City. Please put your questions in the chat. In the meantime, I will open with the first question here from Pahang. This is a question for Indonesian speaker. Can you explain further regarding education that is being implemented in Jakarta? Also for Indonesia, what is the role and commitment of the Indonesian government in the HIV program, especially regarding budgeting, both central and regional? Also for Indonesia, how is the collaboration with satellite cities such as Bogor in eradicating HIV in in Jakarta and the Jakarta greater area. One question to the Philippines. Thank you for providing the strategy for the Yankee population friendly program. Could you please elaborate more on the outcomes result of the implemented strategy that you have explained earlier? And there is a question from Cambodia. Maybe you could elaborate from Cambodia to which presenter you are asking this question for. So I will now ask a presenter from Indonesia, Ibu Dwi Octavia, first to address the questions for Jakarta City and Indonesia. In the meantime, please put your chats here for the other presenters as well. Ibu Dwi, floor is yours.
Thank you, Alice. Okay, thank you, Alice. Thank you, Pahang, for the question. And in around 2021, in Jakarta government, we established the collaborative strategic action that share obligation for other departments besides health to also take action in several health problems like for HIV. So from that commitment, we built like curriculum for teachers, sports teachers, and also for counselor in schools to have trained about HIV issues from elementary school until the senior high school. And those teachers who already trained must then share the knowledge and also develop programs with their students in their schools about HIV knowledge, how to prevent HIV and how to have healthy reproductive health like that. And this is the third years, almost the third years that we do this training for school teachers, and we ask for more teachers and more schools is under this program. And developing the curriculum for the teachers, we also engage with the psychological academy or faculty in order to make sure that the curriculum we establish is suitable for each according to the level of the students that will be taught by the teachers about the HIV and the reproductive health. And may I answer the next question, Alice, for Daniel? Thank you, Pa Daniel, about the question. The question is about the role and commitment of Indonesian government in the HIV program, especially regarding budgeting for central and regional. Maybe I will speak in as a local government representative. And for Jakarta, the local budget for health reached around 18% of our total budget for Jakarta government. And the budget is based on this budget, then we do the program for prevention, promotion, curative and rehabilitative program, and also for the national health insurance. And from the central government, I think the commitment of how the importance of HIV issues is shown by they established this standard pelayanan minimum or minimal standard indicators that should be achieved by all local governments. And also Jakarta seriously try to implement this standard indicator as best as we can. And in the primary health center in Jakarta and also at the government hospital belong to Jakarta province, we have this finance standard as the Badan Layanan Umum, which can also we can also support the health program used not just the budget comes from the provincial government, but also from the budget that comes from patient itself or other source of financing in order to give the flexibility of the budgeting in the health service. And we understand that if we count only from the budget from the government, then there will be not enough budget to do all the programmatic and for HIV and also for other health problems in Jakarta. So now we also considered on the we do the we also now exercise the social contracting system to be established in Jakarta for the future, and also we try to gather more CSR from private companies to be located for HIV and other issues in health in Jakarta. And
there is one more question on Bogor.
Yes, from Bogor. And the question is about how we can collaborate with others surrounding cities like Bogor in eradicating HIV. I think we have some already have some examples about collaboration with other cities in the system of the HIV treatment. We understand that if people living with HIV in Jakarta want to have their treatment in other cities, then the system established by the central government have the features to ease this collaboration. But maybe if you ask for like screening within the adjacent cities, then maybe we can identify like hotspots in near Jakarta that can be do the screening there with the partnering with colleagues from other cities, and if the results turns out to be some of the people living with HIV have to be treated in Jakarta or in other city, then we can also do the follow-up for that. I think we can discuss more about how to have more collaborative action in the adjacent cities in action in collaborative action. Thank you, Alice.
Thank you, Ibu Dwi. Thank you for the questions for Indonesian presenter from Jakarta City. Now we have questions for the Philippines with regards to the young key population program. Many questions about the policy to screen HIV in young key population, because of course in many countries, minor still has difficulties to access HIV service directly without guardian or parental consent. So this is a very interesting question for the Philippines. I'm still inviting questions for the panelists from Phuket City. If I may start with the questions for Phuket City, then this we could have a discussion with Phuket City after the Philippines have addressed the questions. My questions to Phuket City is how important is addressing stigma and discrimination in supporting Phuket City to end AIDS by 2030. So that's a question for consideration for Phuket City. In the meantime, for the Philippines, the floor is yours. Questions on young key population.
Thank you so much for the questions. So for the informed consent, yes, informed consent is still required when the Yankee populations access the HIV testing or treatment. The informed consent is asked at the start, no, even before the treatment and for testing. When they go to the facility to get their self-test kits. So right now, we have no way of providing self-test kits to minors outside of the facility. Although we have partners that does that in community outreach, but when they do get they get education on that and then consent. But when they test positive, they have to get confirmatory tests at the facilities. And when they go to the facilities, they should, if they are 18 and above, then they can go on their own. But when they are at the age range of 15 to 18, so if they are covered by what we call mature minor doctrine, then it does not have to be their parent, but there is a social worker that will assess and then will also guide them in the consent process as well. The other one is in terms of the outcomes, no, of the strategies that I have detailed so far. Unfortunately, I cannot provide you with a good study yet. No, that's one of our gaps of having a good research or assessment study on how these strategies on our young key population are affecting our this population, and also how effective they are, because we also have not yet really strengthened as our strategies at the YKP. So we're just still building those. And I think studies that are in the pipeline that might answer some of that is the HIV prevention strategy. So we are assessing our prevention strategy. So the YKP will also be asked in the assessment as well. But yeah, we can provide you that in another conference, I guess, if the results are already out. And then
so
that's it.
Yeah, that's mostly questions about Yankee populations. And the questions are also being asked to other countries. So Indonesia, for example, is being asked here from Cambodia. What is also the situation on reaching Yankee population in Indonesia? The process of informed consent when the youth was found HIV reactive. So this is a question for Indonesia for consideration. Now we can go to Phuket City, Ms. Wangpun. I have initiated a question about how important is addressing stigma and discrimination, especially in Phuket City, to end AIDS by 2030. So over to you, Ms. Wangpun.
Yeah. The stigma is a problem on most people and decide to get tested for HIV/AIDS because they self-stigma and worry that people around them will know if they are infected with HIV. So that Phuket is try to change the attitude of service provider and make service recipient more to trust. Yeah.
Yeah, so it is very important to address self-stigma because many PLHIV experience self-stigma. Then we need to build capacity of the health workers to build trust with the key population. So that's from Phuket. But these two topics are very interesting actually to be discussed on how we address stigma and discrimination, both also in Indonesia and also in the Philippines. But let's go back to the young key population question on what to do in Indonesia, for example, and also maybe in Phuket and in Jakarta. What happens when a young key population have HIV tests and they are HIV reactive. What would the cities do? Please welcome Jakarta or Phuket.
Alice? Yeah. Maybe I will, yeah. Okay, thank you. First, we try to reach the parents of the guardians of the youth before we do the test, yes, so that they can be we can have the counseling and also prepare for the results of tests. Then next, when the youth then find out to have the test result comes positive, then they will have the ART as if we serve the program for the adults. I think that's the question, the answers.
Okay, thank you, Ibu Dwi. Maybe from Phuket, Suangpum, can you share a situation in Phuket with regards to the process of informed consent when the youth was found HIV reactive to HIV during HIV self-testing or during HIV testing?
In Thailand, children lower 18 can test HIV test no without guardian, no problem.
So in Thailand, there is already a policy to allow minors to have HIV test without parental consent. Yeah, so we have different situations in Indonesia and the Philippines where there are still laws that requires parental consent for HIV testing. How would we work together, for example, to have cross-learning on how to address situation of young key population in ASEAN region? Maybe this is something that we could discuss together. What would be the recommendation? I also welcome recommendations from other countries that are part of this discussion, not only Jakarta or Philippines or Phuket, but also from Cambodia or from Malaysia. Please do share on how you think we should address the situation of HIV in young key population. The other questions is stigma and discriminations. We have seen examples from Phuket where they have addressed stigma and discrimination in the health setting, for example, because they believe it is important to ensure PLHIV who still have high self-stigma to have trust with the health services. So that's why capacity building was provided to health services to address stigma and discrimination that may have been experienced by the PLHIV. I welcome discussion from the Philippines and also from Jakarta on stigma and discrimination.
I'm from the Philippines. Now we also have partners who does capacity building on the stigma and discrimination for health workers, just like in Thailand. And then we also have, like what I presented, joining the Pride Month, because it's one of the stigmatized sectors really in the country, is making that event normalized, and joining that event is also one way of addressing the stigma and discrimination. In addition, we also have a lot of PLHIV organizations that have their own initiatives to engage their centers as well. So that's one way that we can also reduce stigma and discrimination to encourage that enabling environment for them to organize themselves and form their own programs.
Jakarta? Ms. Octavia, would you like to share experience from Jakarta?
Yeah. In Jakarta, we also have this peer group support for youth that is collaboration between the public health, the primary health center, and also for with the local NGOs that provide support to youngsters and also to accompany those who needs further check like screening or others health issues. Also include for HIV screening to the nearest health facility such as a primary health center, and also with the reproductive health program. We like in my presentation that we share information about the health issues to the youth in schools and also for those outside schools, so that they will know where to find for support and help for their health issues when they have some problems in the future.
Yeah, thank you, Ibu Dwi, for the further explanation on how Jakarta work with the local NGO and the local primary health center in reaching and providing services for young key populations. May we learn more about how Jakarta is addressing stigma and discrimination? For example, learning from what has been done in Phuket City.
Okay, at least in issues about stigma in health center, in health facility, and also in work areas is also we very serious about how to reduce the stigma. In the companies or for the laborers, we already have this regulation that when the employees turns out to be reactive for HIV test, then the company should not punish like to fire the employees, and also for reducing the stigma in a health facility. Then we train health staff to understand about HIV and how the transmission, and so that they can see they can be part of the reducing stigma in health facility that they work with. And also in the clinics, also in primary health center, we usually give names of the HIV clinic, not as HIV clinic, but we give other names like flower names or others in order to reduce the possibility of stigma. And also in normalizing the HIV test in Jakarta, actually since 2017, we started the as a part of premarital screening program by the government for all those who wants to get married. Then they will have this some health tests in order to prepare for the good reproductive health, not to prevent them from getting married, but to prepare if one of the partner must have a certain treatment before and after they get married. And one of the health tests is the HIV screening conducted for all pre-marriage couples in Jakarta. And nowadays we see that maybe people more get used to have HIV tests and not place stigmas for that kind of test. Thank you, Alice.
Thank you very much, all speakers. I've been advised that we will need to close by 1:35. It's already 1:30 here in Jakarta. And also we have colleagues who are joining from other countries and also from the Fast Track City Conference itself in Amsterdam. So mindful of time, I would like to thank all the presenters for the presentations and also for responding to the questions and discussions with the audience that we have this afternoon in Jakarta. I would like to summarize a little bit the discussions that have been going on for the past 30 minutes. We have discussed, among others, the issues of young key populations, that it is a critical need that we need to address the situation of HIV and young key populations, especially in ASEAN region. And we have a comment in the chat that parental consent and involvement in HIV testing for minors would be a barrier for them to getting testing HIV testing in the first place. So this is for consideration of countries and cities in ASEAN region on how we should move forward, providing a policy and environment, supporting environment to reach young key populations that are sometimes left behind when they are needing HIV services. We also discussed addressing stigma and discrimination. We have very comprehensive presentations from Phuket City on how to address stigma and discrimination in the health setting. And we also have sharing of experience from Indonesia, for example, on working with the private sector to address stigma and discrimination, building capacity of health workers, and ensuring that the clinics would be friendly for the key population. Also sharing from the Philippines on normalizing HIV testing and also working with the key population network and peer HIV-led organization. We also a little bit talk about financing. There was a specific questions for Jakarta on how HIV program is going to be financed in the future, on how we could improve financing on HIV, not only from the donor, but also from the government, but also from the health insurance, for example, and also out of pocket from the client itself. I think this is going to be a very important discussion in the future on how we could sustain the HIV response, not only at the cities level, but also at the national level. And then we also talk about multi-sectoral engagement, where in the presentation from the partners from the cities have discussed the importance of engaging with the private sector. In the case for Indonesia from Jakarta, where Jakarta City has been able to engage private sector providing telehealth services for ARP home-based services, and also engaging private sector to address stigma and discrimination. In the case of Thailand, in Phuket, where multi-sectoral partners have been engaged to address stigma and discrimination. There are so many best practices that has been shared and discussed today. We hope that it has been useful for all the participants today, for all the audience that are joining from other countries and also from Indonesia, and also from Phuket in Thailand, and also from the Philippines. I would like to hand over now our discussion today to close it and to give it back to our MC to close the session today. Thank you very much for the lively discussion.
Thank you so much, Ms. Alice, for moderating the session. And of course, thank you so much for all panelists from Indonesia, from Philippines, and also from Thailand. So the session has already explored comprehensively, dealing with the best practices, sharing a great experience to integrate the HIV program with encouraging the inclusive approach. One of the great things is a response for our young population, which must be empowered through our program. And also addressing stigma and discrimination as essential parts to support our effort to achieve our triple 95 indicators to get on track to end AIDS by 2030. Thank you so much again for Ms. Alice and all of speakers. So, ladies and gentlemen, we will come to end our session today. And to deliver the closing remarks, we would like to invite Dr. Imran Pambudi as the Director of Communicable Disease Prevention and Control. Dr. Imran, the stage is yours.
Your Excellency, Mr. Budi Gunadi Sadikin, Minister of Health of the Republic of Indonesia, Your Excellency, Dr. Boen Feng Fomalayasit, Minister of Health of Lao PDR, Your Excellency, Dr. Kau Kim Hoon, Secretary General of ASEAN, Dr. Jose M. Zuniga, Executive Director of IPEC, Mr. Imon Murphy, Regional Director of UNAIDS Regional Support Team Asia and the Pacific, mayors of the participating cities of the ASEAN Cities Getting to Zero initiatives, city technical officials, ASEAN Cities Getting to Zero National HIV Contact Points, and ASEAN Cities Getting to Zero National Community Representative, representative of international development partners and regional community stakeholders, representative of professional organizations, civil society organizations, media, ladies and gentlemen. Good morning for those in Seville, and also good afternoon for those in Southeast Asia. It's a great pleasure for me to deliver the closing remarks at the end of this strengthening integration and inclusion of HIV and AIDS programs as priority agenda in ASEAN cities toward ending AIDS by 2030. We are very proud that as a part of the Fast Track Cities Conference 2023, this session has been developed into a very important and outstanding gathering. This satellite sessions today is online to all countries across the Southeast Asia and also in the world. Excellencies, ladies and gentlemen, the government of Indonesia is fully committed to facilitating all cities which are members of the ASEAN Cities Getting to 3 Zeros. We are also committed in hosting the serial satellite session during the Fast Track Cities as a mandate from Nusa Dua Call to Action. On this occasion, on behalf of the government of Indonesia, I would like to express my gratitude and appreciation to the ASEAN Secretary General, IPEC Executive Director, UNAIDS RST Director, all speakers and all head of authorities, health institutions from countries or cities in ASEAN and across the world who have participated in making this gathering a great success. Our gratitude and appreciation also conveyed to the heads of provincial and city and the district health offices in Indonesia who are present and participating in the session. Our appreciation is forwarded as well to all development partners, UNAIDS, WHO, USAIDS, PEPFAR, and also EPIC for your strength, support, and great partnership in our satellite session today. Excellencies, ladies and gentlemen, inspired by the big theme of ASEAN Matters, epicenter of growth, we are fully aware that ASEAN plays a strategic role in the world in ending AIDS by 2030. ASEAN has been and will always be the epicenter or center of excellence of partnership among governments, health facilities, communities, media, and all stakeholders in supporting the effort to achieve 3 zeros, namely zero of new HIV infection, zero AIDS-related death, and also zero stigma and discrimination. Through our sharing experience and best practices in today's agenda, I believe we are able to recreate new ideas and initiatives in overcoming challenges and other crucial issues of concern in the HIV/AIDS response in ASEAN region and in the world. After the implementation of this satellite session, I believe that we have much more stronger commitment and sense of responsibility in playing strategic roles together with all stakeholders in the ASEAN region. We are delighted to be inspired by presenters from ASEAN cities joining fast-track cities for sharing their experiences and best practices in HIV/AIDS response. We are glad to witness how the cities or countries strengthen the integration and inclusion towards achieving the indicators of 95, 95, 95. Certainly, during the last 2 years, our focus and concentration have been divided with the problems of the COVID-19 pandemics. Most of the resources, energy, and effort were focused to respond to the COVID-19 pandemic. From the COVID-19 pandemic, we have learned that integration and inclusion are the keys for ensuring time and cost in an efficient and effective way during the limited time in preventing the spread and avoiding deaths caused by the disease. With regards to integration, one of our presentation themes is engaging the private sectors. We know that ensuring collaboration and partnership between the public and the private sectors is one of the breakthrough, so that all groups in the community can have access to the public and the private sector's health facilities. This means the government should engage the private sector comprehensively and equal to the public sector. On the other hand, related to inclusion, there were 2 presentation themes in place, namely enhancing multi-sectoral collaboration to reduce stigma and discrimination, to end AIDS, and youth-led innovations. With the spirit of no one left behind and meaningful youth participation, the 2 topics are beneficial to reference in our future HIV response. Excellencies, ladies and gentlemen, may I conclude my remarks by expressing my hope that this satellite session will always be the forum in maintaining collaboration, sharing inspiration and innovations, as well as synergizing to move together. Because we know that no maximum result can be achieved if we work alone. And we hope that the best practices and lessons learned presented by all speakers in the field of HIV/AIDS can stimulate us for future follow-up the programs in our own countries and cities. I'm also convinced that we are able to establish sustainable HIV forum of discussion among ASEAN members, especially AGTZ and FTC. Let us continue our sessions, especially those in continuing to the next agenda at the 2023 FTC conference. Finally, I wish you all safe, healthy, and happy so that we can optimally work together to end AIDS by 2030. Thank you.
Thank you, Dr. Imran, for the closing remarks. With that, we end this satellite session. Thank you to everyone for your great participation. Stay healthy, stay safe, and take care. And see you in the next session of the conference. Have a great day, everyone, and bye-bye.